So I think oncologists already, relative to other physicians, have transformed practices. I think they've had nurse navigators for decades. They've understood team-based care for decades. They've taken care of patients, critically ill patients, using evidence-based medicine for decades. All that's new. I think what's not quite as new to oncology practices is expanding the team outside their historical teams. So their historical teams have been physicians, nurses, social workers, pharmacists, nutritionists, physical therapists. That's the historical team that they've been working with for years. I used to be a transplant physician. We had the same kind of team. But what these new models tell us is that you have to expand those teams outside of your normal definition of team. You need to include organizations outside of medicine, churches, schools, even insurance companies, pharmaceutical companies. All of those people and organizations have a role in helping us take care of patients that 99% of the time when they're not in our office or not in the hospital. And so that, I think, is one of the bigger things that the practice has learned from this, is that other heretofore not thought of team members are vital to taking care of our patients. Now, I have one more hope, and the other hope is that parallel to the oncology care model, we have several other big models going on in the country that are care transformation projects. The oldest of the three are accountable care organizations. The second oldest of the three are primary care initiatives, such as the Comprehensive Primary Care Initiative, or the ones going on now, the Comprehensive Primary Plus Initiative. So the Comprehensive Primary Plus Initiative, by its name, is dealing with family physicians and internists and primary care providers. The oncology care model, by its name, is dealing with cancer specialists. And we need to learn how to Venn diagram those three spheres. ACOs, I'll keep away from here. ACOs, the primary care sphere, and the oncology sphere. The oncology sphere is going to be, I hope, the prototype for all other subspecialty models. So the oncologists are just naturally built to do this because they've been doing some of these same patient-centered medical home principles for decades. That's not true for urology. That's not true for orthopedics. That's not true for general surgery. And in many cases, it's not true for primary care. So over the next years, these spheres that are going on in CMMI need to be coalesced together so that when we have learning collaboratives, not only do we have learning collaboratives within each of these spheres, but we learn from each other in these similar projects.